and Dr. Archana Dubey Madam. Dubey Madam is the co-author of many of our Samsthan's TCM books. She was associated very closely with the late Shri Mata Prasad Khemka ji, who was the author of 24 treatises of all TCM publications by our Samsthan. She is Professor Archana Dubey is highly knowledgeable, and it is like hearing straight from the horse's mouth. She will give such a wonderful clarity on diagnosis, because friends, half the battle is won if your diagnosis is correct. You can hit the nail on the head, no beating around the bush, if you are good with diagnosis. Anybody can attend this class from first to any other semester, and especially for therapists, it will be extremely useful. You become a good expert in diagnosis. That's why we have kept this. And Archana Dubey Madam lives in Allahabad. Especially for this purpose, she has flown to Bangalore. And not only that, we have made it. Usually, these kind of programs cost too much of money. At least some 15,000, 10,000 like that people will keep. But to get access easily, we have made it only 3,000 rupees, inclusive of everything: tuition fees, PDF, lunch, refreshment, including everything at a very low cost we have kept. So kindly make use of this opportunity and attend it. You will not regret it. And with this, I'll request our Radhamani Madam to kindly take charge and continue the session. Thank you, Madam.
Thank you for the opportunity, Ravindraji. We are also,
And
we
once
are
again, I'm
like,
telling
I
you,
am
now,
really,
day by day, every session you are showing tremendous improvement. Really, honestly, keep it up, Madam. Yeah, a lot of patience also. Slowly. I mean, you are without losing your calm. You are explaining. Please keep it up. All the best.
thank you, Ji, for the support. This is the first few sessions I am taking it on these subjects. So, thanks to Ravindraji's confidence, I got to do this. So let's start the session with a prayer. Let's join our hands in the Namaskara Mudra with a beautiful smile on your face. This smile is for yourself. Let's bring our attention to Ajna Chakra. Visualizing your parents. Tell their name, however you call them. Visualizing your Guru. Visualizing your Ishtadevata. Let's say our gratitude, thanks and namaskarams to them. Let's observe our breath. It may be from your navel area, that is lower abdomen, or middle area from your chest, or your upper part, or at your nose, or if you can, through the whole body. Observe your breath with a beautiful smile on your face. This body is given by our parents, and we are living in the air. Take a deep breath. I completely love and accept myself as I am. With a beautiful smile, tell yourself, I accept myself as I am. I completely love and accept myself as I am. Bring your attention to your Namaskara Mudra. Open your hands as into a Kamala Mudra. Gently open your eyes on your Kamala Mudra. Let's give a good hug to ourselves. I completely love and accept myself as I am. I completely love and accept myself as I am. I completely love and accept myself as I am. With this, welcome to the session. The reason that we are smiling and accepting ourselves is important part of being a therapist. People are coming to us with their problems. They should have trust in us, right? Our energy should give them trust. As I told earlier, raising the lips is a physical way of showing the happiness within us, and it is contagious and it makes the emotional part automatically. And then we did two more things today. One is Kamala Mudra. This Kamala Mudra, we join your hands like this. This Kamala Mudra basically brings the smile in people automatically. Even though people are not smiling, it will smile. You can just test with them. The third thing is, as a therapist, though we are therapists, we also are human being. We also have health problems, right? So we also need, the problem comes from the mind, and we also need to accept whatever we are. Basically, we need to show confidence. That confidence will come by basically accepting as we are. And this is the way to accept as we are. The easiest, simplest way. So with us, we are learning this EAV to become a good therapist, learning this beautiful technology given by Dr. Wall. So coming to the topic, today we will learn about the basics of all the 8 EAV meridian. I-orbit meridian, it will be a separate one. We will do it later. Okay, the basics we will be doing of all the 8 meridians. So we will revise basically what we did yesterday. What is EAV? It is
Acupressure.
Yes, electroacupuncture according to Wall. But though it is acupuncture, we use it for acupressure also. Right? It is very, very valuable treatment even for acupressure. So how do we treat using EAV? Pressure, seeds, magnets, whatever, however we do all the normal TCM, we do the same thing. Okay. And then who gave this? Dr. Reinhold Wall from Germany. And he was also a normal allopath. Because of his curiosity, he also, as a preventive medicine and also in terms of curing himself, he learned acupuncture. And then the questions arise: why, how? And that led him to, and also to prove to his friends and everyone, to himself, why? To answer his question, he used a machine called Dermatron. That's an electrical machine which used resistance, voltage, and current to diagnose and treat. So for that, through that, he was able to identify the energy in various points, acupoints and non-acupoints. He was able to identify there is a difference between acupoints and non-acupoints, right? And then he went on to measure. Using that, he used very, very, very small micro voltage. So It's not big, but it is significant. So it will not do any damage, or we need not worry about, oh, electricity. We already have electricity in the forms of the nerves conducts electricity. So he used this electrical equipment to identify, measure, diagnose, and treat using the acupoints. And then he developed a method. He identified why only few of the things are used, that is fingers and toes are used, why not the other? Then he was able to identify there are more meridians, there are more points. Even in the normal TCM meridian, there are more points. So he was able to give us, in a normal TCM meridian, he redefined those, rearranged those, and gave more points. And while giving more points, how did he introduce more points? Like heart has how many points in TCM?
9.
Okay. And then he gave more points. How did he introduce those points? So between H9 and H8, he added more points. He didn't change H9 and H8. He added by adding -1, -2, -3, or used -A, -B, like that. So his modification of normal TCM point is given in treatise 4. And how did he modify those? He called pericardium meridian as a circulation meridian. Okay. He called the spleen meridian on the right side as a pancreatic meridian. So spleen meridian on the left side is called a spleen meridian. On the right side, it is called a pancreatic meridian. It is identified by PN. So if you open your treatise 4, it will be identified as PN. Then he identified the TW meridian as an endocrine meridian. So, and then that way he was able to identify the meridians in terms of anatomy, physiology of the body. Like yesterday, we understood or revised, the body consists of the physical framework, that is the skeletal structure, over which there is a muscle, tissue. Inside there are organs and their connections, and every system or organ has the physical part, and then the nutrition is supplied by the blood vessels, so the blood circulation part of it, and then its functioning and its control or managed by the nerve innervations. So he gave us, and then there is a covering, right? So he gave us 8 more meridians identifying these parts of it. Other than the 12 meridians and 2 vessels that TCM gave, and he redefined them. Other than that, he gave us 8 more meridians, 4 in the fingers, 4 in the foot. And those 8 meridians, he identified in a certain order. That order is based on how the diseases develop. And the idea of how the diseases develop is really making our mind to understand how we treat them also. What is the basis of disease that he gave us? What is the basis of the disease?
The story of the disease, humoral phase and cellular phase.
Excretion. That is the basis. That is the basis. Excretion. Okay, the first thing is excretion. That's why in the morning, if we have learned the biological clock, 5 to 7 is a large intestine elimination time, right? we have to help our children or everyone to get up early in the morning, use this time and get cleansed. But stool is one way of cleansing, right? Our body has many holes, many ways. Even the skin pores are there, through which also the body is cleansing. And food and the air we breathe has waste. The body sends it out, but there are other ways, cellular waste, because every organ has, everything in the body has a lifetime, after which it generates, it gets disintegrated, and then the body pushes it out. Same way, there are phases of, like, body tries to fight with external disturbances or internal disturbances. In that process also, there are waste that is coming out. So the body pushes it out by various means, through all the holes, through the skins also. So as part of our daily routine, we have to make sure not only we eliminate properly, we cleanse all the body holes. There are various ways. Okay, so the why I am telling this is because excretion is the first thing Dr. Wall identifies in his humoral phase. Humoral phase has 3 parts to it. The first part he identifies with excretion. And who does this job wonderfully? Lymphatic system. And he gave us one meridian for the lymphatic system, and he paired it with the lungs meridian. So the thumb represents lungs and the other side is lymphatic meridian. And then he identified the next stage. If it is not eliminated properly, we feel like, yeah, I have done, everything is eliminated. But the body will show in terms of various its own ways of showing. Okay. If it is not eliminated properly, the waste gets into the vascular system. Yes. Then it gives in forms of allergies. There are various types of allergies, and he gave one meridian for allergy. And he wonderfully paired it with what? Circulation meridian. Circulation meridian is nothing but related to blood. And the waste goes and sits in the blood. And he calls the allergy meridian as a vascular, blood-related meridian. So he pairs, this is circulation meridian, that is pericardium, right? He calls pericardium a circulation meridian and pairs the allergy meridian with the circulation meridian. So this is how he defines. Then what is the next stage after the allergy? It is the deposition. Basically, I would call this as, instead of deposition, I would call it is the collection of the waste. Okay, the body collects the waste and tries to find out where it can put it. So it collects the waste, and he has given us that meridian as fat.
Fat degeneration.
Fat degeneration, yeah. Fat degeneration only. I just want to show you. One minute, I just show you the PPT also, share the PPT also. So, and then this is the humoral phase. Till that time, any other test reports won't show us. Any other test reports won't show there is a problem in the body, because those test report doesn't count excretion as the major thing. Just 1 second. So this is humoral phase. Humoral phase, otherwise we can, to remember, we can say it as introductory phase, where the reports will not show, but the meridians will show. If there is a problem in the lymph, there is a pain in the points, acupoints of the lymph meridian, that means we can identify. The simple thing that as I have told yesterday, this is the eye. Most of us, it is paining. For most of us, this will be paining. That says we have waste in our eyes that was not cleansed. So the simplest way is just press, put a seed, and usually in the lymph meridian, we sedate the point. So use a magnet to sedate it. In my practical experience, along with this few points, when I do the remaining few points also, so immediately I will get black things in my here. I will be able to get it and remove it. And thanks to that, you might see how, like, some idea of I'm a middle-aged person. I am not wearing my glasses. Now and then I will have blurred vision. Just by pressing these points, I am able to have clear vision. Without glasses, I am able to have, even today, I am able to have clear vision thanks to these points, this system, and acupressure points basically. So it is that effective. And especially in children, we can definitely make use of this system to help remove the glasses. So coming back to it. So,
Ma'am,
yes.
You talked about cataract also, no, for this?
Yes.
In what
Yes.
way it is going to be helpful, ma'am?
According to me, there is no need for surgery if we are cleaning it properly. You would have seen there are some elders who wouldn't have had any eyeglasses, and you would have seen some elders, very rarely, who would have had their teeth till their 80s intact. And there are elders who would have been having a flexible body and tight skin, even in their 70s, 80s, and 90s also. It is simply because the excretion from the body, and also, of course, the nutrition is very important. We are all concentrating on the nutrition. I have to have protein, I have to have this, and I have to have that antibiotic, that prebiotic, probiotic, everything we are looking at it. For the disease to come, more than the deficiency can be supplemented by food and other stuff, but excretion is very important. If there is waste in the body, as we all know, even the food that we keep it for outside for a small time, it gets fungus and bacteria. Because of the waste, the immunity gets affected and it slowly comes out as a disease. And till certain period of time, the modern medicine cannot, the test reports cannot identify the changes in our system. But what shows our EAV system, EAV points, shows us the changes and helps us to remove the diseases or improve the health of the patients at a very early stage. Okay, so the hand has, along with the lung meridian, there is a lymph meridian. Along with the pericardium meridian, that is called circulation meridian in EAV, you have allergy or vascular meridian. And then the lymph meridian, right? There are even the organ meridian is also a lymph meridian, a type of lymph meridian. So we were there in humoral phase, that is excretion, Then a reaction that happens, which is the allergy, for which we have an allergy meridian. Then it is getting collected, which is called, then he gives us another meridian, that is fat deposition meridian. And then he pairs it along with fat is related to gallbladder. Gallbladder helps processing the fat. So he pairs it with gallbladder meridian in the toe. That is the toe next to the smaller toe. If this is the toe, then this is the smaller toe and this is the next toe, and this is the gallbladder meridian, and he pairs it with the fat. How he pairs it? Related things are getting paired. It is easy to remember. Okay. Then after that, it moves on to impregnation. That is keeping it somewhere. That's where tumor, fibroid, the collection, somewhere it collected it and it is started putting it somewhere, wherever. Sometimes it is on the skin, sometimes it is on the various organs, the tumors, brain tumors, or wherever. Inside also there can be tumors anywhere, right? So anything. So then it puts it there and he pairs it with skin meridian. Because skin has various layers. You would have studied in BHP, the skin has various layers, and then he starts putting on those layers. That's why he is pairing it with skin meridian. That he calls it as fibroid meridian. And that is there in the middle toe. So middle toe is free. One side, outside, he is outside of the, if this is the middle toe, the outside part of the middle toe is called skin meridian. Then he is putting the fibroid meridian on the inside, the medial side, lateral side and the medial side. He is putting it, combining these two together. Then there is degeneration meridian, right? In this degeneration meridian, there are three more things. One, joint meridian. He puts it alongside stomach meridian, right? And to easily to remember, we all know stomach 36 is there in the joint. So that's how I started remembering. Then I found out the greatness of how he is pairing it, each of the meridian. So he gave joint meridian. And then he gave, what else he gave? Nerve.
Nerve.
Yeah. Everywhere the nerve is there. You know, and then he pairs it with large intestine meridian. Right? Then organ degeneration, he pairs it with endocrine meridian. Cancer, organ degeneration meridian is related to cancer. That is a malignant stage. That is the later stage of the disease. That he pairs it with endocrine meridian, TW meridian. TW meridian, he calls it as endocrine meridian. Then, just 1 second, I want to share a small picture.
Ma'am, I have a question in this.
Super, tell me.
I don't know if should I ask later.
No, go ahead. Right now, you go ahead.
The point is, you said all these things will not be shown in the reports.
Yes.
We can find out in the initial stage. Now that we don't have a dermatron, like how do we end up finding it?
Simple. It is using the same way. You check using, this is our
Probe, ma'am.
probe. Yeah, this is our probe, right? Yes, I'm trying to get it. One minute.
Ma'am, if it is not diagnosis occur, we can go with these symptoms, ma'am.
Definitely. First, that's why attending those diagnosis session is very important. Like this is a rare opportunity. As much as possible, attend the diagnosis session.
Ma'am, if possible, please take once again the diagnosis session because we are not
Definitely. That is my favorite. I will
missed
definitely
it.
take the diagnosis.
So it's kind request, please take once again because we have
Sure.
missed it.
No,
We are not
I
aware of
didn't.
the Ishan classes. That's why we have missed. Otherwise, we will definitely join. So it's kind request, take once again, please.
I didn't take it. There is going to be one direct class of diagnosis in Bangalore by Dr. Archana Dubey, madam. So the question that you asked is, can you repeat your question, please?
We can't find out through medical tests. And how
Okay.
do we diagnose without the dermatron?
See, there is no need for dermatron because we can feel the pain. We use the probe alongside whatever. Basically, how do we diagnose? We will first hear the symptoms, right? Suppose what can be the problem? Some pain in the eye or redness in the eye. Okay, so where and all I check for the eye? Through EAV. First, the simplest thing I do is hand correspondence. Check whether there is pain here. First of all, listen. We will not generally don't treat with because there is one symptom. The symptom in the, see, these are the 5 senses. And these senses are symptoms. These are not the original root cause. So we have to, using the 8 principles, we have to ask first all the symptoms and then identify and then set the expectation to the patient what we can treat. But generally what people will come and ask, I have BP, I have paralysis, I have a constipation. This is how people will come. But initial stages, first, second semester, okay, you may be able to treat little bit small things like that. If it is constipation, very simple thing, we will have lymph, this one also, but simple thing. This is the correspondence, this is the Swadhisthana chakra, and then this is CV3 and ST25 like that. There are so many ways, there are many points are there. Okay, so we will identify, we treat it. But generally, because we know where the problem diseases are coming, the BP did not come, to cholesterol did not come yesterday. There is, so for so many years, there were changes in the body, the cleansing did not happen. Then the symptoms are showing out to the extent that we understand. Till then, the symptoms we were unable to perceive. But the original problem is excretion and various stages we did not treat it. Once the excretion is not happening, it is showing the reaction, symptoms as allergy. Whatever allergy can be, dust allergy, milk allergy, nuts allergy, or it may be from birth, it may be. That is slightly different. But over a period of time, people, when they come to this place or that place, they will start having such kind of allergies. Those allergies are definitely related to some cleansing. The blood is not cleansed, especially allergy. The blood is not cleansed properly. Whatever it has to contain, it is not having enough, or it is having something extra which it should not have. So that's why yesterday I was telling Tulsi, Bilva, or this one, Neem. That is a very good cleanser. Our ancient system was giving us as a prasad and we were supposed to eat that. Nowadays, we just throw that and eat all the prasadam with ghee and fat and everything sweet. We eat it as prasadam. Okay. And this Dr. Ol was able to identify changes in the acupoints by holding such kind of herbs and his whatever medicines he prescribed, using those medicines also, just by holding with the hand, holding in the body part, tapping with the body part, he was able to see the changes. So that much of effect is there. The body is able to identify such nuances, but for our senses, it is difficult to identify. So when the test report is not showing, we have to use the probe. We have to, if the probe is not there, some non-sharp object, go through the meridian, and now itself I'll take. See, this EAV meridians are on the joints, right? And it is mostly on the palm or the foot. How do we, and on the sides basically. For example, lymph meridian is on the sides. And how do we use the probe? Take the probe and put it on the sides, that is the sides. It is not on the front or back. Okay, it is on the side. If we put it and start from the joint to move it, it will stop. That is one point. Then move it little bit more. That is another point. Then take it more, another point. Like that, you go down. This is another point. This is another point. This is another point. Like this, you identify those points, and once you move and then you go here, then press. Is it paining? Is it paining? And at this point in time, even the I refer the books. I don't memorize all the points and all. I don't believe in memorizing also. So, and then so refer the books, identify what is the point that it is paining. And the first part is, as soon as it is paining, to at least seeds, methi or peas, or even the green gram, just like this. And then some of us, it is here. This is mega meridian points. There will be points which will be paining. So the easiest way, simplest way, the normal layman way is identify where it is paining. There might be definitely some inflammation or the other thing, which we will be able to identify with the probe or with the hands. This is how we will identify. Coming back, so the limb, there are, to treat the whole body, he identifies, defines, or divides the body into 3 parts. Are you able to see the picture?
No, ma'am.
Okay. This is how it is. Now you are able to see it, right?
Yeah.
Yeah. Basically,
Yes,
he
yes.
divides the body into 3 parts. Head to neck, that is shoulder, and then shoulder to diaphragm, diaphragm to below. For example, in the lymph meridian, the LY1 that he says will treat below the diaphragm. Any lymph drainage that needs to happen below the diaphragm will be treated by LY1. LY2 will treat the thorax, that is above the diaphragm till the shoulders. There might be slight exceptions, but this is the general thing that he defines and gives us. And the third thing is LY3 normally treats neck and the head. This is how it is common along. And the same way, he has given various points. What are the various points? Most important point for each of the meridians, he has given various points. Which is the most important point that we learned yesterday? It is a CMP point.
CMP point.
Yeah, control meridian point. That tells the health of the organ. Control meridian points tells the health of the organ. Likewise, he has given reference point. What is reference point? In order to measure, like he was using electrical equipment, he had 2 probes. He need to have 1 probe somewhere, right? And always, how do you refer, like which is shorter or which is longer? How do you identify if something is shorter or longer? How do you identify? I am shorter than, who is the reference? I am taller than, who is the reference?
Keep next to each other.
That should be a reference. See, this is smaller than this pencil, right? This is smaller than, maybe in the height wise, this clip. So this is the reference point. Likewise, there is a reference point for each of the meridian, which was used as a reference, and then it is measured. Then there is something called measurement point. It will tell the functioning of the particular organ. And then any meridian or anything that the meridian is referring to, it may be an organ, it may be a tissue. It will have various parts to it. For example, heart has 3 lobes on the right side, 2 lobes on the left side. So various parts to it, right? Then there are separately identify each of the parts, functional disturbances and all. So he has given points. That is summation point, measurement point. Then there is not only the organ, there are disturbances. If there is disease, there are disturbances surrounding the organ also. To identify surrounding the organ, he gave the point PSMP, partial summation measurement point, that he gave to understand the disturbances that has happened around the problem organ. Then serous membrane coating or peritoneum point, SCP. Serous membrane coating or peritoneum point. There is a covering, right? And this covering helps to hold the organ in its position. It also protects, right? For example, if the organ next to it has some cancer or any infection, this covering tries to protect it also. So it also does protection as well as keeping the organ in its place. And if there is any problem to this, we will be able to identify using the SCP. And then we know every organ, or most, we are guided by the nerves system. So he identified a point for nerve innervation. So that he called autonomic nerve innervation point, which gives us the health of the nerve related to that meridian or that organ. Then, most important, the point that I love is lymphatic drainage point. It tells us how healthy, how pink of health is identified by the LDP. First, we will identify the LDP and treat. It gives profound effect. That's what we have seen in the practice. So these are all the points are there in each of the meridian. There might be some points, more points in each meridian. There might be measurement points or SMP point or like that. There might be more number of points in a same meridian. So let's now come to, we will revise one more time. You are able to see the tissue meridian, right? So this is lymph meridian. We remembered it yesterday through the acronym LONE. So lymph is outside. L, then O A N. Right? Lymph, he paired it with lungs. He has paired it with endocrine, that is TW. Then allergy, he is pairing it with vascular, that is blood meridian, pericardium, which he calls it as circulation meridian. Circulation is nothing but, circulation system is blood. And then he pairs the nerve meridian, this side, with the lungs meridian. So lone, that's how. And then he paired fat meridian with the gallbladder, which is related. He paired it with joint meridian with stomach. Then he paired the skin and fibroid because the impregnation of the excretion waste gets deposited in the various layers of the skin. So with this we are clear, and the various points on each of the meridian we are clear, and most of the points that he has defined are on the dorsal part of the palm or the foot, exception for the lymph meridian. Okay, and then how he has defined the body, he divided into 3 parts. The first point is to cleanse anything that is referring to or treating below the diaphragm. The second, it will be treating to the above the diaphragm till the shoulder. The third point, it will treat, this is the general idea he uses, treat the neck and head. So the lymph meridian treats the lymphatic system. Nerve meridian treats the meningitis and meninges and nervous system. The vascular degeneration, allergy or vascular degeneration treats the vascular system. The organ meridian, degeneration meridian, treats the deep lymphatic system. So there is a connection between lymph and organ. Lymph is at the superficial level. Organ degeneration at the lymphatic system drainage at the deep level. Then fibroid or interstitial degeneration treats the connective tissue. Skin degeneration treats the skin and scars, anything related to the skin and scar. Fat degeneration treats the fat tissue, and eye orbit treats the eye diseases. These are the 9 meridians that he has given. Now, lymph meridian. What is lymph? It's a fluid tissue, right? Yellow fluid tissue. And what is lymph? It is blood minus RBC. Blood has plasma, the liquid part of it, and cells part of it. Cells, there are 2 types of cells, RBC, WBC. When the blood is removed, the RBC is removed, and then I will show you a diagram which explains.
Ma'am, shall we take it as plasma?
I wouldn't take, yeah, basically that's the plasma, but the lymphatic system collects all the waste also. Hence, it is not plasma. Okay. So what happens is,
After centrifugation, we can.
Pardon?
After centrifugation, we can segment the RBC, right now. We are separating the RBC. After that, plasma.
We are not separating. Let's see how the body is separating it.
Okay.
Are you able to see the birth and flow of lymph?
But it has got WBC also, ma'am.
Yeah, it has got WBC. Yeah. See, are you able to see my screen? Lymph, birth and flow?
No, ma'am.
No, ma'am. Only these 3 divisions is showing.
Oh, okay. I will just share. Okay, now you're able to see it, right? Lymph, birth and flow. So basically what is happening? What is lymph? Heart, it is trying to supply the good blood through the arteries to all parts of the body. And now and then, to reach the innermost part of the body, it flows through the capillaries. Due to the pressure of, like, from big area to small area, due to the pressure, some of the blood oozes out and comes to the tissue below it. You can see the tissue below it and the capillaries there. But the capillaries are so small, it can't drain out the RBCs. Okay. Then there is a lymphatic system which catches that whatever the oozed out blood. You can see it in the green color. That is the lymphatic system. Okay. It catches it and then it collects all the waste from everywhere. And the lymphatic system is something like this. You can see the lymphatic system goes along with the blood circulation. If you can see the picture, you can see the white nodes and all, right? The lymphatic system contains, like blood vessel, there is lymph vessel everywhere going through the body. And there are nodes. You can see the white pearl-like things. Those are the lymph nodes. There are 3 parts to the lymphatic system. The lymph liquid itself, the lymph vessel which holds the lymph, and then there are nodes. And these nodes are prominent closer to these organs, like spleen, near appendix, near pancreas, near the large bones, near the thymus, near the small intestine. There are many white nodes you can see. Along with that, many a times you will see in the larynges, pharynges, tonsils basically. There you can see near the armpit, near the inguinal area, between the legs. You will see on the 2 sides between the legs, you can see lot of lymph nodes. These are all the nodes which collects near the spleen. And also you can see in the center, that is next to the spleen, there is a center part. The thick, that is the place the lymph vessel is very thick. And then there it gets divided into 2. What is happening is, it collects waste from all these places and then it supplies it to the vena cava, that is supplies it to the heart, which collects all the waste blood. You can see it, not here. Okay. Okay. So basically, even in this picture, you can see the lymph finally collects everything and takes it to the supravena, that is the vein that supplies deoxygenated blood to the heart. It not only gives the deoxygenated blood, it collects waste from all over the body and gives it to the blood, gives it to the heart. It comes from the heart and then it ends at the heart itself. From the artery, it supplies, that's how from the artery, it supplies nutrition to the places where it cannot reach out. The blood vessels cannot reach out. And then it also collects the waste. It collects the waste and then gives it to the heart for cleansing. Okay. And the lymphatic system flows all over the body. And there are various parts which are very important where there are more nodes. And we would have learned when we are learning about spleen. It works as a major cleanser of the body. Like dead cells and all, it cleanses. Spleen is getting affected. That's what we say. And if there is any cancer patient, we will also treat the spleen very much because the spleen may not be removing the dead cells. Then how he has given EAV, in EAV, what he has done, he has given 24 points for lymph meridian. And these are diagnosis and treatment point also. And when he says lymph meridian, there are two types of lymph meridian. One is lymph meridian itself, which is on the thumb, and it goes up to the back of the shoulder. There are 24 points, and all these points are used for diagnosis as well as treatment. And out of the 24 points, he calls it as LY1 to LY14. In between, he gives us 1A and all he gives us. That we can see it in your book, rate as 3. I am not showing it here. So the lymph that is on the superficial, next, just below the skin is called lymph meridian. The deep lymph is called organ degeneration meridian. And say after LY14, the lymph system goes from UB36 and UB49. The wastage are getting collected from UB, that is UB is urinary bladder. It goes and comes back, like 2 lines of urinary bladder is there at our back, right? So UB36 to UB49, that also acts as a lymph meridian. Collects the waste. Same way between SP9 and SP21 also, it collects the waste and gives it to the lymph meridian. And also every meridian that he has defined 8 plus 8 meridians, right? He plus TCM meridian, whatever he has defined, it has a specific point. Every meridian has a lymph drainage point. That also he has defined. So that much is the importance of lymph meridian. And out of the 24 points, usually the control measurement points are, there are 3 joints in each of the fingers and toes, right? The middle joint, in Ayurveda we call it as Pitta joint, right? Usually the control measurement points are just above the center point, this Pitta joint. This is usually the EAV meridians are on the sides. It is not the yang side, it is not on the inside, it is on the sides and on the groove of the joint. If there is a bone, okay, here you can see. Here you can see the bones. See, every finger has, the 4 fingers has 3 bones. This top bone, this one. And these bones are called, fine. So if you identify, I told you have to identify from the joint, you have to identify like this, Move the probe, it will stop somewhere. That is one point. Move the probe, it stops somewhere. It is another point, like this. So this control meridian points are usually from here. If you move the probe, that is the control measurement point. Now, whatever I am showing, it is a control measurement point of nerve meridian. Here, it is a control measurement point of
Allergy.
allergy meridian. Yes. Here, it is the control measurement point of organ degeneration meridian. There is one exception. Heart meridian has the control measurement point at 8C. This is H8C. This is the control measurement point of, it is below this pitta joint, middle joint. So it is easy. If you want to treat any meridian, you don't have anything, just do the pressure. Or put a methi petti here. You will be treating the related CMP and it is easy. And except 8C, that is heart meridian, which is slightly below this joint, all are above this joint. All the CMPs are. And we know which body part, based on that, you can identify and treat. If there is a scar is where? Below the diaphragm or above the diaphragm. Then if it is related to scar, you will be treating skin meridian. Right? And if there is any problem related to even constipation, we treat the lymph meridian. And then people will come with throat pain. For usually the limbs where we will get affected, where is the external bacteria or anything that goes into our body, through our mouth, through our nose, mainly through our skin, that is using our hands. It would have gone inside through our mouth, nose, or sometimes with eyes and ears also. And throat there are 5 types of tonsils. You would have seen, here you will be seeing the center when you open A and then see there, that is pharyngeal tonsil. And then the sides, palatine tonsil. Between these two, there is something called, between these pharyngeal and palatine, that is tubal tonsil. Then to remember easily, tongue is used for language. So the tonsil that is there is called lingual tonsil. He has given separate points for these tonsils. Okay. And then if you see, this I have already told you, 2A, lymph 2A. Likewise, this is for the, after the eyes, there is nose. Then this point, this is the lymph meridian and center is eye and this is nose and sinuses. Same way, this is LY2A. This is for jaw and teeth. And LY here. This is the CMP point for the LY. General, any problem, just put it. And then if you see, I will share you one more picture. One minute, I'm just trying to find out. How do I show from my file? Are you able to see? So LY1 is Valentine tonsils. This LY1 is Valentine tonsil. If you come slightly down, it is for the ear. Then all the tonsils. This LY1, 2 is a CMP for all the tonsils. And then if you come here down, this is for tuber tonsils. Then this LY2, this is for all the teeth and jaw. This is a CMP. There are, see how many control points? Lymph has more control point, not only one. See, this is for CMP for any teeth related problem. LY2 here, you will be treating. Then if it is ear, eye, it is LY2A. Then this is LY3 for sinuses and nose. And then any cough or anything related to lungs and mediastinum. This will be here. Here. Look at the position and identify the point correctly. And then anything related to esophagus. Just before this here. Then just above this, radial. Then next, if you see, there are points for heart and pericardium. See, there are two bones in this limb, this part of the limb. Radial and ulna. This is radial, this is ulna. In the radial side only, the lymph meridian is there. So in the start of the radial, you will see heart and pericardium, which is definitely used for any deposits, arterial sclerosis. All this will be used, these points. And then to treat the upper extremities. Upper extremities are our hands. That is LY6. Like this, if you see, we will be able to see, these pictures are there in the book also. Okay, look at the book for reference. So like this, he has given the points LY9A. It is for the lymphatic drainage of aorta and aortic lymph nodes. Till, that is 11 and 12 are very important. 11 is for brain and spine. For the lymph drainage of brain and spine, LY11. This also works as, how do you identify LY11? This is your collarbone. Slightly above the collarbone, there will be a, if you put it here, you will be able to find the top rib of your lungs. That is LY11. This is for brain and spine. This is for your endocrine lymphatic drainage. Some of you might be, if you press here, you will be feeling the pain, some kind of inflammation and pain. It is also for pituitary, thymus, thyroid, such endocrine glands. It is also for liver and gallbladder. It is also for pancreas and spleen. It is also the lymphatic drainage for kidney and stomach. And there are more points for the same organs. There might be more lymph points. For example, again, LY12. LY12, where it is here. Here, in the collarbone here. So, LY12 is for spine and medulla oblongata. Again, it is for kidney, spleen, pancreas, stomach, and also for 5 tonsils. LY13. LY13 is if you keep your hands down, keep your hands like this. See, like this. That is LY13. It is for gallbladder and hepatic duct. It is also for the sympathetic nervous system. And sinuses also. It is also for people, most of us who are having, generally will have pain over the neck, cervical spondylitis and all. Here it will be paining. If you feel there will be a lump, you will feel like this. If you put your hands like this and your middle finger will reach there. This is LY13. Then slightly below, if you put it back like this, it is LY14. It is for spine and spine marrow. It is also for urogenital, including UB and urogenital organs. It is also for pineal and spinal gland. It is mainly for urinary meridian, bladder meridian also. And there are various lymph drainage points in the UB meridian. As I told you, starting from this LY14 joins with UB36 here and goes till your buttock, that is down till UB49. Those are all drainage points only. So even in your massages that you do the massage, lymph drainage massage is there. That connects these points to do the lymph drainage. So likewise, there are 24 points in lymph meridian. Some of them are reference points, some of them are MP points, some of them are CMP itself, which are very, very useful. Likewise, the other meridians are there. The very simple meridian I will take now. Allergy. Allergy is a big topic. There are various types of allergies that you know, and it comes because of wastage that is accumulated in the blood. Even the rheumatoid arthritis is also, the allergies are different types. It comes from the external object. It comes because of like rheumatoid arthritis, and there are some allergies that comes after some fevers where whatever the waste that are supposed to go, it is not gone. In rheumatoid arthritis, it goes and sits in the joints and it goes and sits in the blood. So such problem can be treated by AD meridian. Again, AD meridian has only 6 points. AD meridian is the middle finger on the sides. So AD1, this is, then AD1B, that is the CMP point. Then very easy, down is AD2 and this is AD3. Simple. We have already known 1, 2 and 3, which part? Identify, and along with that also give 1B, which is a CMP. Simple, right? Then JD meridian. In JD meridian, again you have only 5 points, 7 points actually. Again, follow the system JD1, JD2, JD3. JD1 is below the diaphragm. Any problem related to the joints, joints of pelvic girdle, joints of lower extremities, the hip bone and sacrum joint, lumbar joint, that is JD1. And JD1B, in the same way, if this is a toe, the toe also has 3. joint, 3 parts, 1, 2, and 3. And CMP points comes in the middle joint, above the middle joint, usually. Simple. Identify. So along with wherever the problem is, do the CMP point also. And for the joint, usually when the joints are there, there is a synovial fluid. To improve the synovial fluid, especially as we grow older, the synovial fluid dries up. So 1C is the point. JD 1C is the point for synovial treatment of the synovial fluid. And then JD2 is for the shoulder, girdle, and the arms. It is for the upper extremities. And JD3, it is for the C1 and C2. The cervical part is there, no? C1 and C2. It is the point. For spondylitis problem, it is the point, JD3. Along with JD3, what do you put? CMP point. Where is the CMP point? It is the middle joint of the toe. Just above it is the CMP point. Toe. I am not showing my toes. It is the middle part of the toe. Basically here. Wait, I will show you this. See, this is the joint meridian. There is a middle part to it. Are you able to see it here now? Along with the stomach, the joint meridian is there. So the middle part, just above the middle part, the JD1B is there, which is the CMP. So whatever the joint problem, treat that part. It is only 7 points. So one is for CMP, one is for the synovial fluid, and remaining 3 for the 3 parts to it. And along with such points, for example, if it is upper jaw or lower jaw problem, if it is an upper jaw, you know where TW23 is there. TW23 is end of the eyebrows. So if it is an upper jaw problem, along with JD3, you treat the TW23 also. And if it is a lower jaw problem, you treat the ST2 also. Stomach 2 also you treat. So you will get better effects. Like that, he has also given what is the combination points. Then in fibroid also has only 5 points. Fibroid comes, the deposition comes and sits in where? The various parts of the skin, right? And fibroid can be fibrosis, which is increased fiber, that it makes it is stiffness. Cirrhosis, there can be cirrhosis. Again, that is also stiffness. And then stenosis, which is the chronic inflammation. And there are strictures. Strictures are narrowing of the, usually urinary strictures will be there. Okay, because the waste gets deposited there inside and then reducing the pathway. Like that, there can be fibroid, and only 5 points are there for the fibroid. Where is the fibroid meridian? Is the middle toe that you are seeing it here. And as we have already learned, fibroid 1, that is the point 1, FIBD1. Okay, that point will treat below the diaphragm. Any fibroids below the diaphragm, that is pelvic, abdomen, lower extremities, it will be treating that point. You will be treating that point along with the CMP. Where is CMP?
On the joint, middle joint side.
Middle joint.
Yes,
so if there are any fibroids on the chest or the back of the chest, anywhere, you will be treating FIB-D2. And then FIB-D3, you will be treating anything with neck and shoulder. That's all.
Ma'am, for
Yes.
uterus fibroids, ma'am.
What fibroid?
Uterus.
Yeah, it will be FIB1 along with FIB 1B. Along with that, there will be more points we will be treating in the endocrine glands and other things. But in EAV, these are the points that we will be treating. Definitely it works.
Ma'am, for allergy?
For allergy, where will you treat? AD, vascular meridian.
Yes. Middle finger.
Middle finger, yes.
Hmm.
Remember? LOA. Next to
Middle
the
finger.
circulation, pericardium meridian, this is this side. So for any allergy, first you put, I have seen it, experienced it, definitely this 1B CMP will be painful. And allergy, usually the liver would have got affected. So the general point you combine with allergy is LIV3.
Lymph
Okay,
3.
these information are all there in your book, Treatise 3. This is just a starting point of you guys to start reading the understanding and learning. When you start reading it, you will have some information so that when you read it, you will understand better and you will have Samastan classes also. So don't worry too much about it. This is the whatever I have given is starting point to open the book and read. Now when you go back and take your book and start reading, you will be able to understand little bit here and there and put ticks into practice. So with this, I would like to close this session if there are no questions.
Before that,
So
Ma'am.
much, ma'am.
friends, I would like to speak for a few minutes only. Friends, in our regular syllabus-based classes, this kind of explanation is not possible due to time constraint. See, hardly you get 15 hours of teaching, and it is very difficult to cover treatise 3 and 4. So naturally, only summary you will get. For example, in our class, in today's class, our faculty, Madam Radhamani ji, has explained the lymph meridian in such a elaborate manner, you can never forget it. It is so beautifully explained. Friends, lymph meridian has got two major roles to play. One is it works like a municipality, clears the drainage, dead cells from the body, puts it to spleen for burning. In other words, cleansing the whole system of the body. Second thing is fight the pathogenic factors, whether it is virus or bacteria or fungus or whatever it is. According to acupressure, the pathogenic factors are wind, heat, hotness, humidity, dryness, coldness. We don't go by which virus, bacteria and all. In other words, it fights the bacteria. WBC means what? It is a defense force. And very nicely explained from UB 36 to UB 49. Yeah, that is overlapping the lymph meridian. In other words, for example, liver 18 is the backshoe point of the liver. By the side of that, the lateral urinary bladder meridian is lymph meridian only. Suppose in your liver you have got cirrhosis or something accumulated, fatty liver or whatever it is. Liver 18 is the backshoe point. By the side of that, on the same line, UB42 is there. That is the lymphatic point of the liver meridian. So if you want to clear UB42, you just sedate. All the accumulated dampness in the liver will get cleared. Suppose somebody has got turbidity in the kidney, EGFR, expected glomerular filtration rate is not 92, it has come down. It is not able to filter properly. Kidney disease is there. Backshoe of kidney is UB23. So to cleanse the kidney, what you have to do?
Today.
By the side of the UB23, kidney, UB47 is there. That is the lymphatic system of the kidney. You treat kidney UB47, kidney gets clean. Overlapping means like that, for every organ, the backshoe point is there. On the lateral side, there is urinary bladder. Lateral side is nothing but lymphatic system, beautifully explained. You can cleanse the related organ by treating at that point. Similarly, for spleen also, from spleen 9 to spleen 21, which flows in the front portion of the body. Whatever the accumulation, dampness, pus, whatever it is, if you want to clear, see the location of this, which is the nearest location of the spleen meridian, and treat, and that unwanted accumulation will disappear. Friends, I take so much of time and energy and effort. More than me, the faculty will give their life, a part of their life to us. Their life forever, she is donating to all of us. She is operating from a giving domain to help us to empower ourselves with so much of knowledge. But our response is really, I feel so disappointed. Very few people are encashing it. I have a lot of enthusiasm to bring more and more people to empower all my students. Friends, I request every one of you to please announce this in your groups that such a class has taken place, and please attend, for others to motivate and attend and get benefit at no cost. This is my humble request, friends. I have so many, intention and plans to bring in, very good faculty to empower all my students. And, I would like you to kindly respond. Now, the class is so good, madam. Now, we will not leave you till you complete all the meridians, including TCM meridians, according to Dr. Hole, all the important points. It was very, very, very impressive. Be blessed by the divines. We are very thankful to you, madam. Wonderful class. Keep it up.
Thank you, sir. Thanks to your support.
Yeah, now I'm very proud,
Thank you,
Ishan
sir.
is able to produce good faculties day by day. I'm really proud. So friends, if you got any query, you can ask the query. The further classes will, in consultation with our Radhamani madam, I'll announce it in all the groups. You can all, most welcome to join. And friends, one more appeal. See, friends, this divine knowledge we have to spread. Our motto of our Samsthan is to reach one, treat one, teach one. In other words, we have to mobilize students for first semester. Please, this is an Andolan revolution. Please help us to mobilize students for first semester. We'll be very grateful. We are not for our personal interest. It is to make our country medicine free. So with this, I'll hand over the session to madam. If any query is there, she'll respond properly. Okay. Thank you, friends.
Thank you, sir.
Okay, if there is no queries, thank you. As Ravindraji said, but more than my life I gave you, it is more for my learnings also. Why he was telling reach one, teach one, treat one, right? 4 years back, what I was and what I am now, I am totally a different person in looking at not only our body, mainly for the family. And when we go to the doctor or hospital, it's a transformational change that we have seen. And slowly people in the house also accepting these changes. I'm very glad that all of you have started your journey in acupressure. So please continue this journey. Don't leave it. Suddenly, when there is next semester, should I continue or not? That kind of questions will always keep coming. My family, my friends, my fellow students, and Mr. Ravindra ji has pushed me into this level wherever I am. And it will be useful to me. I am very convinced. I hope all of you could reach till the 10th semester. All the best. As Ravindra ji has told, in the future, I will definitely take the remaining meridians in detail also. But currently, with this, I am ending the EAV sessions. In the future, I will meet you. I'm very, very happy and thankful for your participation, because your participation encourages me to prepare better. Okay. Thank you. Thanks, Ravindra ji.
Thank you, sir. Thank you so much. A small doubt, ma'am.
Yes.
Itching in the scalp, ma'am.
Hmm.
How to treat?
What is itching in the scalp means?
Head.
No, before that, when you are scratching, is there anything coming? And itching is?
No. Itching in scalp.
Yeah. So this is part of the skin meridian, right?
Hair is loss.
Hair loss also. Okay. So first of all, hair is loss means it's excess or deficient because of which the hair is lost. See, because that will come under diagnosis part of it.
Okay.
If you are asking for treatment, we should follow certain diagnostic procedure which would have studied in the second semester. We will identify whether it is an excess or deficient. And using EAV, if you see, it will be skin meridian.
Yes, ma'am.
Yes. And the body is unable to, when you are scratching, what is coming? Is there anything coming?
No, ma'am. No.
And then if it is scratching, it is the blood supply to that place is less.
Yes.
So along with skin meridian, you will also treat the circulation and allergy meridian.
Okay, ma'am.
So as a first point, we will put skin CMP and allergy and circulation CMP.
Okay.
From what you have learned, this is where we will treat.
Okay, ma'am. Thank you so much.
Thank you, Vaishnav.
Thank you.
Thank you so much, ma'am. It was very wonderful 2 days, very informative. Though I'm a semester 1 student, actually I'm Revati from Malaysia. Your class was really interesting, and of course I don't understand the terms that you're saying, CMP, SNP, all these are quite new for me. But of course, I'm the pathway to learn better, and what Mr. Ravindra has said. It is something very interesting. Yeah, I'll be continuing my semester 2 for your information. Thank you so much once again for your time and effort.
So before we will end the session in a different way. So let's do the acupressure of our CMPs. You can use the rings also, like this kind of rings also, but today we will use our fingers. This we can do it anywhere, right? Likewise, you can do it in your toes also. And let's clap. This is overall hand correspondence of the whole body, right? Very good, very good. Yay! When you are doing it, see, when you are pressing this in the biole, these are all liver meridian, like that, right? And ST25 and all. So you do this press. Very good, very good. Yay! With a beautiful smile. Very good, very good. Yay! Very good, very good. Super. Very good, very good. Super. Then quickly pressing this. With a beautiful smile. Good night. Thank you. See you in the next sessions, the future sessions. Bye.
Thank you so much, ma'am.
Thank you, ma'am. Thank you so much.
Thank you, ma'am.
Bless you.
Welcome.
Thank you, ma'am.
Welcome. My pleasure. Okay, Ravindraji, let's close the session.
Priyanka ji, can you please close the session?